Hi, you guys. Dr. Jessi here with Dr. Jessi Grajczyk, another Jessi. One of our amazing interviews with the experts. She is an absolute mastermind in the world of obstetrics and women and prenatal care. We have so many stories that we hear about Dr. Jessi in what she does for women. I'm going to let her give you a little bit of her background, tell you her passions, and then we're going to dive into the prenatal and postpartum realm surrounding hormonal support and some of the things that women can do to prevent dealing with autoimmune dysfunction after they have their baby. There are things, though, that you can do during that prenatal realm that she's going to talk about. So here we go.
Hello, I'm Jessi Grajczyk. I'm trained as a DO, trained in Des Moines, Iowa. With the DO training comes a lot of alternative therapies, learning about the mind, body, spirit as a whole. So that has always been my passion. Continuing to learn and grow, doing a bunch of alternative courses and classes and with functional medicine, etc. So that is my main passion and background.
And that's what we love about you. What I really want to dive into most specifically is Hashimoto's, any of those autoimmune disorders that women typically see postpartum. So we've also seen it where patients end up with type 1 diabetes. For myself, I ended up with psoriasis. It really flared up postpartum after my second baby, all of these things being autoimmune related. And you and I have talked about the preventative things that women can do to find out more of what they are dealing with personally, but then also the things they can do to help prevent dealing with all of that postpartum. Do you want to dive into that?
Yes. Yeah. So, what I've been learning most recently is a lot more in terms of the gut in general. So specifically, the types of good, many of us are very deficient in the types of good bacteria. So now there are multiple different kinds of gut tests that you can do in terms of being pregnant and or pre-pregnancy. If somebody is deciding like, okay, we're thinking about trying, you can do these types of tests there. And the bottom line of the results of the test is they are determining with some of this data and the new data that like specific probiotics are helping reduce gestational diabetes, which is an autoimmune. I don't have the literature, the data out yet in terms of specifically thyroid for this test. But in general, if you're just assuming like if you have healthier gut lining and gut health, then your autoimmune disorders, et cetera, are going to decrease your risks. So also, if you're postpartum and being diagnosed with this sort of thing at this time, you can also do the gut test at that time. Doing this gut test at any time frame is going to help you and not, you know what I mean? Like we just have to kind of move forward in terms of when we learn it. The other thing in terms of thyroid, I've been learning more about. So when you're diagnosing this with a patient immediately postpartum, there's six main ingredients. There's six main ingredients in terms of what you need for the thyroid to function. Yeah. So a lot of the times is that I have been finding many deficiencies in people. So for example, the six are vitamin A, vitamin D, selenium, zinc, and then also iodine and iron. So, and the best way to test these levels is also complicated. So you need a provider that knows how to test them because iodine is the best tested urinary way. So through your urine. So anyway, I've also been finding like deficiencies in some of these vitamins and minerals causes us to have a thyroid disorder. So if you first can supplement and figure out the deficiencies, then you're treating the thyroid and you don't necessarily need the medication. If you can kind of figure out first, sometimes it's as simple as being deficient in one of those types of things. So the whole point though is that you kind of have to think whole how do I like big picture in terms of like thinking what this specific organ needs, whether it's, so if it's skin, a lot of the times I go for the gut because you know that what comes out of the skin is typically surrounded from the gut. So people have acne, people have rashes, people have etc. That oftentimes you start with the gut lining too. So yeah, it's just kind of having a bigger, broader picture in terms of understanding how these things kind of work. Anxiety also, there's so much more literature coming out in specific probiotics treating anxiety because there's such a gut brain access now that we are becoming more aware of. So yeah, so I would say for most people, I would start with the gut in terms of getting gut testing and then going from there and doing the test, basing the results on you individually and what you're deficient in, and or have overgrowths in, and then we can treat it based on that.
How early in pregnancy do you think it's wise, or do you advise testing for this? And how early postpartum do you advise testing for this?
Yes, I would say because most of these tests take about a month to come back as well. Um, and they also now, I mean, this is a little bit of another stretch, but they also have like vaginal health testing to help in terms of timing for when you're having the baby so that you have the perfect microbiome for the baby's sake as
Oh,
well
so
to
cool.
decrease. Yes, so cool. So I would say around that. I mean, if you're having problems, do it then, right? Like
Sure.
if you're having symptoms, do it whenever it is you're having that. But I would say for sure by like 20, 24 weeks, just because it gives you enough time to make changes, to be able to have that. They usually say it takes about 3 to 4 months to heal and get that gut lining prepared and repaired with specific, if you're doing different probiotics, etc. So then again, postpartum, it just depends on when, some people don't have postpartum depression until 6 months. Well, then you would do the testing then, if that's when you're figuring things out. Otherwise, I would say you could do it anytime because in general, you're going to learn so much more about your body no matter when you're doing it.
It's incredible. It blows my mind where the literature has gone with all of this and the research. I'm a big proponent of gut health. I am with my own kids as well. And going through it as a woman naturally, then I'm also always talking about it with my girls. I mean, and they're coming into that adolescent phase as well. So like their hormones are starting to change. The conversation is all around gut. I think they get
Yes.
tired of talking about the gut, as do I think maybe my patients. But I am really glad that we have providers out there like yourself who are having the conversation because I do think it changes how women get to feel both when they're pregnant and then obviously postpartum because so much shifts and we just don't always anticipate it. And we don't, women don't always think about gut. So I will encourage anybody listening to this to reach out to Dr. Jessi Dr. Grajczyk. Her name is spelled really, it's not like you would think. So it will be
Yes.
listed here if you're needing to reference, but please reach out with questions, thoughts. Certainly your provider, if you're not seeing Dr. Grajczyk, even though you should, because she's wonderful, but anybody who's having some concerns, don't be afraid to reach out, even to us. We can always navigate that or help you navigate that as well. Thank you, Jessi. You are amazing. This was phenomenal
Thank you.
information that we have not had in the OB world like this. And it's just, it's inspiring. So thank you so much for your time.
Have a great day. Thank you.